Depression is a widespread mental health condition that affects millions of people worldwide. Fortunately, there are numerous treatment options available, including medication, therapy, and lifestyle changes. One of the most popular medications for depression is Wellbutrin. However, many people are still unsure about how it works and whether it's right for them. In this comprehensive guide, we will explore everything you need to know about Wellbutrin, from its benefits and side effects to its dosage and administration, precautions, and warnings. By the end of this guide, you will have a better understanding of whether Wellbutrin is the right choice for you. What is Wellbutrin? Wellbutrin is an antidepressant medication that is used to treat major depressive disorder, seasonal affective disorder, and to help people quit smoking. It is also sometimes used to treat attention deficit hyperactivity disorder, ADHD. Wellbutrin is the brand name for bupropion, which is a norepinephrine-dopamine reuptake inhibitor, NDRI. This means that it increases the levels of norepinephrine and dopamine in the brain, which are two neurotransmitters that play a crucial role in regulating mood. How does Wellbutrin work? Wellbutrin works by blocking the reuptake of norepinephrine and dopamine in the brain. This means that these neurotransmitters remain in the brain for longer, which can help to regulate mood and improve symptoms of depression. Wellbutrin also has a unique mechanism of action in that it does not affect serotonin levels in the brain, which is the primary target of most traditional antidepressants. This makes it a useful option for people who have not responded to other antidepressant medications. Benefits of Wellbutrin. There are numerous benefits of Wellbutrin, which is why it is such a popular medication for depression. Some of the main benefits of Wellbutrin include improved mood. Wellbutrin is highly effective at improving mood and reducing symptoms of depression. It works quickly and can help people feel better within just a few weeks of starting treatment. Increased energy. One of the unique benefits of Wellbutrin is that it can increase energy levels and reduce fatigue. This can be especially helpful for people who struggle with low energy levels as a result of depression. Reduced cravings. Wellbutrin is also often used to help people quit smoking because it can reduce nicotine cravings. It is also sometimes used to help people with other types of addiction, such as cocaine or methamphetamine addiction. Weight loss. Wellbutrin has been shown to help some people lose weight, although the mechanism of action is not fully understood. It may be related to its effects on norepinephrine and dopamine levels in the brain. Side effects of Wellbutrin. Like any medication, Wellbutrin can cause side effects. Some of the most common side effects of Wellbutrin include dry mouth. Many people experience dry mouth as a side effect of Wellbutrin. This can be alleviated by drinking plenty of water and using sugar-free gum or mints. Insomnia. Wellbutrin can sometimes cause insomnia or difficulty sleeping. This can be mitigated by taking the medication early in the day and avoiding caffeine and other stimulants. Headaches. Headaches are another common side effect of Wellbutrin. These can usually be treated with over-the-counter pain relievers. Nausea. Some people experience nausea or stomach upset when taking Wellbutrin. This can be alleviated by taking the medication with food or reducing the dose. Who can benefit from Wellbutrin? Wellbutrin can be an effective treatment for many people who struggle with depression, seasonal affective disorder, or ADHD. It is also sometimes used to help people quit smoking or with other types of addiction. However, it is not suitable for everyone. People who have a history of seizures or an eating disorder should not take Wellbutrin. Additionally, Wellbutrin can interact with certain medications, so it's important to talk to your doctor about any other medications you are taking before starting Wellbutrin. Dosage and administration of Wellbutrin. The dosage of Wellbutrin will vary depending on the condition being treated, the severity of symptoms, and other individual factors. In general, the starting dose for Wellbutrin is 150 mg per day, which can be increased to 300 mg per day after a few weeks if needed. It is important to follow your doctor's instructions carefully and not to adjust your dose without consulting your doctor. Precautions and warnings for Wellbutrin use. There are several precautions and warnings to be aware of when taking Wellbutrin. These include seizures. Wellbutrin can increase the risk of seizures, especially at higher doses. People who have a history of seizures should not take Wellbutrin. Suicidal thoughts. Like other antidepressant medications, Wellbutrin can increase the risk of suicidal thoughts or behaviors, especially in children, adolescents, and young adults. It's important to monitor for any changes in mood or behavior and to seek medical attention if you or someone you know experiences suicidal thoughts. Pregnancy and breastfeeding. Wellbutrin should not be taken during pregnancy or breastfeeding, as it can pass through breast milk and harm the infant. Wellbutrin versus other antidepressants. There are many different types of antidepressant medications, each with its own unique mechanism of action and benefits. Wellbutrin is often used as a second-line treatment for depression, after traditional antidepressants have failed to work. It is particularly useful for people who have not responded to other medications or who have experienced unwanted side effects from other medications. Alternative medications to consider. Selective serotonin reuptake inhibitors, SSRIs. SSRIs, such as Prozac, fluoxetine, Zoloft, sertraline, and Lexapro, escitalopram, are a widely prescribed class of antidepressant medications. They work by increasing the availability of serotonin, a neurotransmitter associated with mood regulation. SSRIs are often considered as first-line alternatives to Wellbutrin due to their established efficacy and relatively favorable side effect profiles. Serotonin norepinephrine reuptake inhibitors, SNRIs. SNRIs, such as Cymbalta, duloxetine, and Effexor, venlafaxine, are another class of antidepressant medications. They work by increasing the levels of both serotonin and norepinephrine in the brain. SNRIs may be suitable alternatives to Wellbutrin, especially for individuals who have not responded well to SSRIs or require additional norepinephrine modulation. Tricyclic antidepressants, TCAs. TCAs, such as Elavil, amitriptyline, and Pamelor, nortriptyline, are older antidepressant medications that have been used for many years. They work by increasing the levels of serotonin and norepinephrine in the brain. TCAs are considered alternatives when other classes of antidepressants have been ineffective or poorly tolerated. However, they often have more side effects and require careful monitoring. Monoamine oxidase inhibitors, MAOIs. MAOIs, such as Nardial, phenelzine, and Parnate, tranylcypromine, are an older class of antidepressant medications. They work by inhibiting the enzyme monoamine oxidase, which increases the levels of serotonin, norepinephrine, and dopamine in the brain. MAOIs are typically reserved as alternatives when other treatments have not been successful, due to their potential for interactions with certain foods and medications. Atypical antipsychotics. In some cases, atypical antipsychotic medications, such as Abilify, aripiprazole, or Seroquel, quetiapine, may be used as adjunctive therapy alongside an antidepressant to enhance its effectiveness. These medications work on different neurotransmitter systems and can provide additional mood stabilization benefits for individuals who have not responded well to traditional antidepressants alone. Frequently asked questions about Wellbutrin. How long does it take for Wellbutrin to work? Wellbutrin can start to work within a few weeks of starting treatment, although it may take up to 4-6 weeks to see the full effects. Can Wellbutrin cause weight gain? Wellbutrin is actually associated with weight loss in some people, although the mechanism of action is not fully understood. Can Wellbutrin be used to treat anxiety? Wellbutrin is not typically used to treat anxiety, although it can be helpful for people who have anxiety as a symptom of depression. Conclusion. Is Wellbutrin right for you? Wellbutrin can be an effective treatment for depression, seasonal affective disorder, ADHD, and addiction. However, it is not suitable for everyone and can cause side effects and interactions with other medications. If you are considering Wellbutrin, it's important to talk to your doctor about whether it's the right choice for you. Your doctor can help you weigh the potential benefits and risks of Wellbutrin and develop a treatment plan that is tailored to your individual needs. With the right treatment, you can find relief from your symptoms and regain control of your mental health. Thanks for watching.